One of the most recent developments that came out in USA Today is the significant costs of the health care for our veterans and TRICARE, how much TRICARE has gone up over 120% in the last several years, particularly with the baby boomers coming online, many of them in military service, myself for example. We're going to be using TRICARE. And with the TRICARE costs rising, the administration has put out a test balloon, just like the Clinton administration used to do, and is talking about raising the rates or copays for military veterans. I think it's a bad idea. And here's what we ought to do. We ought to use the veterans to start fixing the healthcare system. And what I mean is we should use TRICARE to fix the things that are wrong with national health care. Our national health care bill, Obamacare if you will, didn't tackle the most important thing that it needed to tackle, and that is the cost of health care. There are many, many things that need to be fixed with health care. We ought to start with the veterans programs and make those the standard for the rest of the country. So fix veterans health care. And one of the other things I think we ought to do is for congressional health care, both in the Senate and the House, and for anybody in the administration, they should have to use TRICARE, just like the retirees in the military do and the active duty. That way we would ensure that TRICARE would be fixed. And of course, I think that's the most important thing we can do.